This is Dr. Ihab Abdurrahman Ihab Tarawa, consultant of acute care medicine at Soba University Hospital, professor of medicine, University of Khartoum. This session is about transport of acutely or critically ill patient. As we mentioned before, patient transport is a big challenge and it carries a high risk. Always we have to balance the benefit and the risk. If the patient will get better service, better diagnostic abilities, then we go for the transportation. Planning of the action is affected by medical and nurse team of the unit and consider the following problem. Before you kick off, you have to plan the staffing and the equipment needed. En route, you have to decide about the method of transportation, and the receiving service should be considered and should be informed before you kick off, and you have to evaluate the distance and the risk associated with it. In the planning phase, you have to select accurate monitoring method and devices, and you have to have a prediction of possible complication, and you take the appropriate preventive and intervention measures. Selection of general and specific therapy instrument. Therapy, if it doesn't add value during transportation, is better to avoid it. The choice of transport team, it depends on the patient condition and available staff. Planning personnel for a critically ill patient, you need at least 2 medical personnel. You need a doctor, and he will be the team, or she will be the team leader, and usually will be responsible for airway and circulation monitoring and management, plus overall situation management. You need a nurse, experienced ICU nurse, to prepare medication, to administer them, and to prepare IV fluid. And in addition, you need the ambulance team and a porter. Regarding equipment for respiratory support equipment, it depends on the level of the respiratory support. Start with oxygen source plus oxygen mask, depend on the level of flow. In addition, bag valve mask, and if you are anticipating a surgical airway cricothyroidotomy equipment or set, and in case of trauma, you might need pleural drainage equipment. Always you take a pulse oximeter with you. If a patient connected to a mechanical ventilator, then you have to take a portable ventilator plus end-tidal monitoring. Regarding the mechanical ventilator, make sure it is fully charged, it is well functioning before you start, and you need to set the alarm, and also you have the oxygen source and it fit well with the equipment you are taking. In addition, you can plug the ventilator in the ambulance if it have the appropriate socket. If patient is taking IV medication, you make sure the syringe or infusion pump is fully charged and it is well calibrated and in a good functioning condition. You have to pack all the necessary medication. All medication the patient is taking, you should take extra doses, because if you get any problem during your journey, so you can have enough stock, and you take medication for anticipated complication. Make sure you tape all line and tubes. Any loose tube can get disconnected, and always keep the necessary IV fluid and solution running. Any fluid that or medication can be postponed is better to stop it, so that you can reduce the level of intervention and interaction during the journey. For critically ill patient, you are just making a mobile ICU unit. You are taking the ventilator, you replace it by a portable one. All the medication in the medication tray, you put them in the special bag, medication bag, and all the respiratory equipment, you put them in a specific bag, and you have the monitor plus the oxygen source. In addition to this, you have the appropriately assigned personnel. Take patient information with you. Take the history, a copy of the medical record, investigation, radiology study, consent form, and also make sure the destination ready for your arrival. And before you start, you have to do the ABCDE immediately prior departure. Make sure team member they know their role. They check all the equipment and medication, and you have to do it, but do it right. It is not about getting there, it is about how to get there safely. Transport plan. Have you carefully considered specific transport condition, lighting, vehicle, road, weather condition, distance, and anything else can affect the journey? During bad traffic, is better to delay or avoid transportation, and sometimes during weather condition, you might need to use alternative methods. When you arrive, ensure proper handover of the patient record. Give them summary. Tell them about any event that happened during transportation, and do a final ABCDE assessment in the final environment before leaving the patient. Take home adverse event during and after transportation are high. Few patient-related risk factor can be identified. Rate of equipment-related adverse event is also high. In some cases, hazards of transporting a patient could be prevented by performing diagnostic or therapeutic procedure in the ICU, like bringing the endoscopy inside, having a facility for inside dialysis or continuous renal replacement therapy, and in some places they have a portable CT scan. So the best preventive measure to avoid transport-related complication is not to transport, but the second alternative is to transport safely. And thank you, and see you in the next session.